Hello and welcome. I am Gimba Umar. Tonight, ECOWAS health ministers adopt a One Health approach to combat diseases in the region. Gunmen kidnapped 3 students and a lecturer of the School of Midwifery in Kaduna just 1 week after a lawmaker was abducted. All Progressives Congress chieftain gather in Port Harcourt to celebrate the achievements of Transport Minister and former River State Governor Rotimi Amechi. And at least 58 are presumed dead from the devastating fire at a residential building in West London earlier in the week.
And in business news tonight, fund managers ask federal government to finance 2017 budget through the capital market to ensure transparency.
On sports news tonight, Confederation of African Football (CAF) backs Kenya to host the 2018 African Nations Championships, despite being behind on schedule.
We begin tonight with the resolve by the West African Health Organization, an agency of the Economic Community of West African States, ECOWAS, to adopt a One Health approach to combat emerging threats to public health in West Africa. According to the Vice President of ECOWAS, Mr. Edward Singate, the approach seeks a multi-sectoral collaboration with member states to curtail the spread of diseases.
For 5 days, health ministers of the ECOWAS Commission have been meeting at the ECOWAS Secretariat in Abuja to brainstorm on how to better tackle health emergencies in the region. Recommendations, including that of strengthening local capacity for vaccine production, have been made by the ministers. At the final day of this meeting, attention is fixed on how to implement the One Health approach of the ECOWAS Commission, an approach that seeks regional and multi-sectoral collaboration to combat disease outbreaks.
The objective of this first meeting is to fast-track the implementation of the One Health approach in the ECOWAS region, and more specifically, to firstly adopt the terms of reference of the ECOWAS One Health Regional Policy Coordination Platform.
The ECOWAS Vice President also explains why member states should work at implementing the One Health approach immediately.
The need to formalize the One Health approach in the world in general and in West Africa in particular was further reinforced by the 2014 to 2016 Ebola virus disease outbreak, with an unprecedented death toll of more than 11,000 lives. In addition, this urgent need is evidenced by the growing threat of ongoing epidemics in the region, such as the recent outbreak of the Rift Valley fever.
Meanwhile, the representative of the Food and Agriculture Organization emphasizes the importance of the multi-sectoral approach to combating disease outbreaks.
Reducing the threat to public health, therefore, is not a task just for one sector. Multi-sectorial collaboration under a One Health approach is the practical way of protecting public health, but also safeguard livelihoods.
The West African region has suffered several disease outbreaks, especially since 2014, when the Ebola virus dealt the region a blow, killing about 11,000 people. The expectation now is that the One Health approach adopted by the ECOWAS member states will be fully implemented to either prevent the spread or minimize the effects of future disease outbreaks.
Some medical practitioners have called for reforms in the National Health Insurance Scheme to strengthen it and cover some health conditions and surgeries that are currently excluded from the scheme. The Chief Medical Director of the Federal Medical Center Abeokuta and other practitioners made this call during a meeting with health workers in Ogun State. He's also calling for the extension of the scheme to capture the larger population of people living in the rural areas in the country.
The National Health Insurance Scheme was introduced by the federal government in 2004 to provide easy access to healthcare for all Nigerians at an affordable cost through various payment systems. For easy access, it was stratified into primary, secondary and tertiary care. But 13 years after, practitioners say the scheme has been confronted with many challenges, with many people not captured in the system.
What we want to see as an improvement to this program is to capture all Nigerians, because basically it is the civil servants that are enjoying it, and a few wealthy Nigerians who have registered with private health maintenance organizations.
We are not there yet, but at least we have something in place that we can call our own. So we need modification. We need to still build our bridges and say that it is effective and it makes our patient to be satisfied. But at least we have something on ground.
The acting medical director.
And to ensure more people are captured in the scheme, the acting chief medical director, Federal Medical Center Abeokuta, says the scheme must be strengthened in terms of its operational base to include some of the health conditions that are not currently captured by the scheme.
The National Health Insurance Scheme should be strengthened to cover some health conditions and surgeries that are currently excluded. The program needed to be extended to the grassroots for the meaningful benefit of the large population who reside in the rural areas. Conducive atmosphere will be provided to attract our medical and health workers who have left the shores of Nigeria for greener pastures. They needed to be encouraged to come back to their fatherland by joining hands with those at home for a better and improved healthcare delivery services.
The health practitioners are also calling on both the state and the federal government to put measures in place to check the incessant industrial actions that have over the years faced the health sector.
All three students and a lecturer of the School of Midwifery, Tudunwada in Kaduna State, northwest of Nigeria, have been abducted by gunmen suspected to be kidnappers. The students and the lecturer were reportedly kidnapped on Friday along Burinengwari Road in Burinengwari local government area of the state when they were traveling on a 20-seater bus to visit one of the students who was hospitalized in the area. According to a security source, the gunmen intercepted the bus loaded with about 20 students and whisked 3 students away, including the lecturer who was accompanying them to the trip. Although the Kaduna State Police Command is yet to confirm the incident, a top source from the state government told our correspondent that efforts are being made to secure their release. The latest incident is coming barely 5 days after over 10 people were kidnapped along Kaduna-Abuja Road. The police in Benue State has bust-dusted 2 kidnap syndicates in Makurdi and Katsina local governments, allegedly led by a female associate of the wanted militia leader Tewase Akwaza, alias Ghana, operating the suspects at the command headquarters in Makurdi. The police commissioner, Bashir Makama, says that one of the gangs kidnapped a businessman and his son, who was later released to source 20 million naira ransom for his father. Commended the security forces for their increased motivation to tackle the menace of kidnapping. The special advisor on security matters to the state governor, Mr. Edwin Jando, believes that the anti-kidnapping law has brought hope of improved security across the state.
8 kidnapped suspects arrested by the Benue State Police Command in Makurdi and Katsina local governments after the kidnapping of a local businessman by the gang allegedly led by a female hairstylist.
Who is a driver to Ghana's wife.
According to the police, the female gang leader is an associate of wanted militia leader Tewase Akwaze, who directed them on the operation and demanded for 20 million naira ransom. The suspect denies the allegation.
I was sleeping in my room around 9 o'clock. I hear knock on my door. PM or AM? PM. I hear knock on my door. Before I open door, they shoot leg on my door. Before I see the police officers, they arrest me. Damn kidnapping.
The special advisor on security matters says all the suspects will be prosecuted under the new anti-kidnapping law that attracts a death penalty.
Since they passed the law, the impetus has become stronger. The police have been energized. They are happy doing the job now because the penalty for kidnapping is very severe. the death sentence. The governor once told me that he will be in court on the first case of kidnapping, that he will be in court that day.
The Commissioner of Police, while giving details of the arrest, says the suspects will soon be charged to court for the various offences.
4 of these kidnappers were arrested, including 3 women who were feeding him during the period of this kidnap. And again, as I want to reiterate here, that this was the handwork of the notorious Ghana, because all the technical information that we received has to do or is related to him.
The police says it is leaving no stone unturned in ensuring that all criminal suspects, including the elusive militia leader Tewase Akwaze and his gang, are brought to justice.
In the meantime, not less than 19 children have been rescued by the Nigerian army from suspected kidnappers in Katarko in Yobe State. Well, according to the Director of Army Public Relations, Brigadier General Sani Osman, the troops of Bravo Company 120 Battalion 27 Task Force Brigade made the rescue during a routine patrol. The Army spokesman says that the 4 suspected kidnappers were taking the children from Potiskum, that is, to Garintuo, Bungai and Buniyadi in Gujba local government area of Yobe State and Galarabala in Biu local government area of Borno State as well. Both the suspected traffickers and their victims have been moved to the brigade headquarters for transfer to the National Agency for the Prohibition of Trafficking in Persons, NAPTIP. Politicians and prominent Nigerians today gathered in Port Harcourt, the River State capital, to pay tribute to Minister of Transportation, Chibuike Amechi, on his 52nd birthday anniversary. The event, organized by the Conscious Reformers Assembly, also served as a symposium to reflect on the achievements and leadership style of the former governor of River State. One of the guest lecturers, Professor Austin Kenny, challenged leaders on visionary leadership that will enhance the life of the people.
It's the 52nd birthday symposium of the former governor of River State and Minister of Transportation, Chibuike Amechi, holding in Port Harcourt, the River State capital.
Chibuike Amechi!
The event is put together by leaders and supporters of the All Progressive Congress, APC. Some of those in attendance include the Governor of Plateau State, Simon Lalong, some members of the Federal Executive Council, and party faithful from the 23 local government areas of the state.
And righteousness.
One after the other, the speakers extol the virtues of the former River State governor.
From his very humble background at the grassroots, he grew up with the masses. He dwelled with them for long. He was a Diob dweller and resident of the area, and also schooled there. He was nurtured at the grassroots. He might have felt the pains and pangs of poverty. He likely felt the empathy and sympathy of his poverty-stricken society.
Against the suggestive unitary might of the center, so you protecting the service delivery mandate of governors when you elsewhere as the chairman of the Governors Forum. You are a man of many parts and of many impacts to the lives of those whom God has brought to test of your leadership courage.
Why is this man so identified and being honored today as he's been honored many times? It is because his people see him as a leader. Being seen as a leader, it means he has the qualities of leadership.
For the celebrant, politicians should eschew the politics of bitterness and concentrate on improving the lives of the people.
There is no local government that did not build minimum of 10 primary schools. True or false? Okay, when we started as government, we had a total of 725 primary schools. As your governor, I did Port Harcourt to Owerri Road. True or false? That's the federal project, is it not?
Although it was meant to be a birthday celebration, it turned out to be more of a political gathering showcasing the achievements of the former governor during his 8-year stint in charge.
In part 2, after the break, Kaduna State government and Igbo leaders allay fears over any ethnic attacks in the state. Stay with us.